You are automatically muted. We're thankful for your patience in the waiting room. And I know that means you have to hit connecting your audio, which makes you officially in and connected. We are glad you're here. And you have been automatically placed on mute because we love you enough to help you along the way for that. We are thrilled to have you here in our coffee talk, the second one of the year. Last week, Father Dave led a discussion about New Year's and things like that. And we are so glad you're here for our wonderful conversation about one of those fabulous topics of our current day and age: COVID, vaccines, and everything in between. We're delighted to have Dr. Zorn here today. And we're still letting people in. We're going to continue doing that, and then we'll get underway in a couple of minutes as y'all realize you have automatically been muted. And we're glad that you are in this space. Again, good morning and welcome. Welcome, welcome, welcome. We're giving some of our folks on campus an opportunity to zip into their offices and get online too. I know they'll be joining us. Good morning and welcome. Philip, it's good to see you. Thanks for entering into the chat. If you didn't catch worship this morning at 8 in person or at 10 in person or online, don't worry, you can watch that later today. It's already there and easily replayed. If you want to share that message from Father Dave today with others, very easily done by sharing our online worship page and online recordings. It is such a gift to be able to share those services any time of the week. So we are glad you are here today. Father Dave had a wonderful message, both with his children's homily. I teasingly said to Mandy Schnicker, we've got Bob the Builder, who's also the priest, because Father Dave wore his construction hat as he led the conversation about building up the kingdom of God, which truly is our baptismal requirement. And again, how we live in community and build up both one another, but also our community and larger community that we live within. Welcome, welcome, welcome. We have a couple more people coming through, so we're just trying to get everybody in. Again, we are glad that you are here for our coffee talk today. Coffee talk and COVID shots. It almost rhymes, but it's not quite the same. Espresso will keep you wide awake, and this vaccine will keep you healthy for the larger community. Yay, look at all these things. I love it. My watch is buzzing. My computer keeps buzzing. It is a wonderful reminder of this wonderful community that we are all a part of. Again, just a couple more minutes and then we'll get going. I am delighted to share and introduce the screen our keynote speaker this morning, Dr. Don Zorn. He serves on the COVID task force, that group that has been navigating these waters since March 14th, which was our last Sunday in person and first meeting of that task force. We gathered around one large table together to discern what are the next steps. Dr. Zorn and Dr. Laura Brock have been our medical advisors on that team and have really helped us to make the best decisions for our larger community, considering who we are, who our community serves, and how best to do that in the safest manner possible. Don Zorn is one of the most calming presence, as I have consulted with him on matters of staff, on matters of our greater community. And I've decided that if he were to open up a podcast, he could call it Zen with Zorn, and everyone would feel better, even if he told you no, because he encourages you with facts and science to be reminded of the preciousness of life, and that even when we have to hold steady where we are and our heart wants to do something else, it's okay to breathe in deeply and be present right in that space. So Dr. Zorn, again, thank you for all you have done since and before March, but now as you share your wisdom and knowledge about the COVID vaccine Thank you, thank you, thank you.
Good morning, all, and it's nice to see you. Thank you, Mother Abby, and also thank you to Father Wallace for inviting me. And for the inevitable complaints about this presentation, please address them to Father Wallace. His contact information will be provided for you. So we've been under this black cloud, and it's honestly the darkest that it's been, but we're not really here to talk about that. We're talking about the silver lining around that cloud and the hope that vaccination brings and how we got to this point, which is pretty amazing. We're going to talk about the vaccines, their development, several facets about immunity, and why I personally am very hopeful about these vaccines and what the ending point will be for us some months away. I'm a primary care physician and I'm retired, which means that any knowledge I once had is quickly slipping away. So I will say that this coming Wednesday, the true experts will be speaking Village Square, which is a project Skip Foster, one of our parishioners, is leading, is partnering with TMH to provide a conference from 1 to 2 on Wednesday, the 13th. So if you're interested in that, these are two national experts talking about the same thing I'm talking about today, and hopefully correcting what I do today and adding to it. So I'm going to start by just running through some real quick questions. Many of this, much of this information you already know. I realize you're probably up to speed with the vaccines pretty well by now. But I'll do some quick questions, provide the quick answers, and maybe that'll get you thinking about what may be questions you want to ask me toward the end of this. So how many vaccines are available? 2. How many doses do you need for each of them? 2. Should the second dose be the same kind of vaccine as the first? Yes. Which one should you take? Whichever one is available to you first. Are these FDA approved? No. They are under emergency use authorization. We'll talk about that. Are they safe? Yes. How about pregnancy, breastfeeding, and immunocompromised people? Are they safe? Yes, yes, and yes. Should I worry about the speed of development? No. Wonder at it and give thanks. Are the side effects more than the flu shot? Yes, especially with the second dose, and we'll talk about that. Can the vaccine give you COVID? No. Does the messenger RNA get into your genetic material and change you somehow? No. I happened to get the Moderna vaccine on Thursday, and according to Tasca, other than going outside and scratching in the grass for worms and saying cock-a-doodle-doo early in the morning, I am having no problems. So don't worry about that. Do you need the vaccine if you have had COVID test positivity or illness in the past? The answer now is yes. That may change, but for now, yes. Will the vaccine make me test positive? The answer to that is no. Will the vaccine work? Yes, amazingly well. Will current vaccines work against newer COVID variants? A very important question. The answer, I think, is yes. Theoretically, yes, and backed by recent evidence just in the past couple of weeks. So immunity, the body's immune response. How does this work? I think it's be good to go through this a little bit so that we can understand the vaccines better. There are two types of immunity, and one is humoral immunity, which these are the antibodies that circulate in your blood that find the offending agent and work to destroy it. These are done by a type of lymphocyte called B cells. B is in beta cells. The second type is cellular immunity. And think of this, these are the T cells, and think of them as the angry white blood cells. If you go to a concert or a bar and there's a bouncer outside and you've misbehaved before and they see you coming in again, think of the response of that bouncer to you as these are the angry T cells that remember you and are not going to let you in. They have amazing memory, and this lasts for a long time. And this is what gives me great hope about these vaccines, and also about the illness too, about long-term immunity. So the vaccines and the illness promote both types of immunity, the humoral, which we can measure in our blood with the antibodies, and the cellular immunity, which is much harder to measure. So we get an initial dose and we get a booster shot. So how does that work? Well, if you have in your yard fire ant mounds, as we do, and you happen to brush against a fire ant mound, you will see a response. Initially, it's somewhat measured. The ants don't know quite what to make of it. They'll come look around, a few of them, and they'll go back in. But if you brush it a second time, you will notice 100 times as many ants come out because they've been waiting to see if something else happens. So with booster shots, you're getting that second response. It'll be 100 times greater. And that's why when you get your second dose of vaccine, expect a little more significant amount of systemic side effects because you will be getting more systemic response and hopefully better immunity because of it. So how did we get to this point? Why has it been so fast that we get a vaccine? Usually it takes 8-10 years for vaccines to be developed and brought on the market. Well, the fact is, even though this is a novel virus that we have not seen before, it comes from a group of viruses that we have seen before. 4 of them cause the common cold, and 2 of them have caused significant disease and outbreaks that were stopped somewhat short of a pandemic. And that was the SARS, the systemic acute respiratory syndrome in 2002, and MERS, the Middle East respiratory syndrome, 10 years later in 2012. So these viruses have been looked at as a source of potential pandemics. And a lot of research has been done, particularly over the last 10 years, in sequencing, the genetic sequencing of them. So the ground, and even some early vaccine development for some of them. So when in December, this deadly pneumonia started in Wuhan, China, those researchers saw what was happening and says, could this be a coronavirus? And the answer was quickly yes. And by the end of December, early January, they had the exact genetic sequence of COVID-19 to work with. And so they took the prior research and they applied it to the new virus. And that is why we've been able to get this vaccine so quickly, because it's these very smart people standing on the shoulders of people doing research for the past number of years. Now, there was a great segment on 60 Minutes. I hope you saw it. If not, go back and look at it 3 or 4 weeks ago. And it talked about this German company, BioNTech, which is relatively small, but it has very smart researchers One of them knew one of the head researchers at Pfizer, and they saw what was going on and said, can we partner together? Pfizer, a much larger company, able to put a lot of resources toward studying vaccine development and also manufacturing a product. So Pfizer and BioNTech combined together to bring together the first vaccine that came to market. They did not take the Operation Warp Speed funding, but they did take the government's guarantee that they would buy millions of doses from them. The little engine that could, Moderna, who nobody had hardly heard of, and had never brought a product to market that had ever gotten FDA approval. They did use Operation Warp Speed funding, and they moved right along, and they brought the second one to market, both of them coming and being available in December. So that's incredibly short period of time. So how are vaccines developed? Usually there's in 3 phases. Phase 1, which is relatively small, where they measure different doses of the vaccine to see what's safe, what's tolerable. So phase 1 is based on safety. Phase 2 continues safety on a larger group, but also looking at effectiveness. And then phase 3, a much, much larger group, where effectiveness is the hallmark of what they're looking for while still looking at safety. So typically they're sequential, phase 1, phase 2, phase 3. But think of your handheld telescope that you pull out in three stages and you push it back together. That's what's happened with the research into these vaccines. So phase 1, phase 2, and phase 3 have been not just sequential, but they've been ongoing together. And that has shortened the period of time. But it has left us with at least 2 months of phase 3 data. And that's what they have been able to go to the FDA with to show and ask for this EUA, emergency use authorization. This whole process was helped by so many wanting to volunteer for the studies. They didn't have to ask or recruit because they were beating down the doors to participate. Thousands of people. In COVID-19, the virus cooperated too by infecting a lot of those volunteers during the course of the study. So you should know that there are more than 100 vaccines currently being developed. The current ones that we have, these other vaccines use a variety of different mechanisms. The ones that we currently use are very much alike. And we've all seen models of the coronavirus. It has these spikes, these club-looking spikes. These 2 vaccines are aimed at the spikes on the virus, the spike protein, and the antibodies that are produced are called anti-S or anti-spike. So when you take the vaccine, you're taking in multiple little particles that are little lipid envelopes, and inside there's messenger RNA. So these 2 vaccines work through the mechanism of messenger RNA. So messenger RNA is usually taken from the DNA in our nuclei, and they send messages out to little factories in our cells that make proteins. And so when you take this vaccine, multiple little packets, the lipid packets allow the messenger RNA to get inside your cells, and you make these spikes. Probably most of the spikes are made in your muscle cells. And then your own body sees these spikes as foreign and start to make antibodies. And also cellular immunity, which is a little bit more delayed. So when you get your dose, you get mostly a regional response. So you get the soreness in the muscle where it is. This lasts a couple of days. That's about the most you get with the first dose. In the second dose, you get a much better, bigger response, and you get more of the systemic effects, possible little fever, chills, muscle aches, joint aches. Those are more common with your second dose. So that's how the vaccines work. And they work, the two we have work almost the same way. And they have the same effectiveness, about 95%, which is just amazing. Think your flu vaccine each year, the effectiveness varies somewhere between 40 and 60%, which is not that much. This is almost twice as effective as your usual flu shot. So what about the variants that seem to make the vaccine more infectious? Will the vaccines work for that? Well, they should, because all of the viruses that we know of, and there are hundreds, we already know of hundreds of different types of the COVID vaccine. This has not been a stationary target. It's been changing the whole time. It's all of them have that spike protein. It's the spike protein, I think, that allows it to penetrate the mucus of our respiratory tract, cling there and get to the cells of our respiratory tract, and they're infect us. So as long as the virus uses the spike protein to work, these vaccines should work as well, even the variants. So a couple of weeks ago, it was reported in a study that took serum from 20 people who had been vaccinated, fully vaccinated, each of them, and exposed that each of their serum to the virus in the lab. All of those cause suppression, complete suppression of the virus in the lab. So theoretically, the vaccine should work against the new variants. And here we're getting this evidence, at least in the lab, that it works. That'll need to be backed up by in vivo or in live people. But I think that it will. So breathe easy about the variants. I think they're a problem in terms of infectivity, but not in terms of therapy. Now, are these vaccines safe? Now, these are real concerns because we've contracted the usual research and study phase from years into months. And then there was a powerful man in Washington who was also pushing it for his own transparent and selfish reasons. And that's created some degree of anxiety. But I want to reassure you, and I hope you'll reassure others who are hesitant, that there were 30,000 test subjects in the Moderna trials. There were 44,000 in the Pfizer BioNTech trials. At least half of those actually got the vaccine. We've had months of study of those. And since the vaccine's been out, about 5 million doses or so have been given, and so far, so good. So there are immediate reactions to the vaccine. So the most worrisome is anaphylaxis. And this is immediate low blood pressure, even shock associated with whatever. So there have been 29 reports concerning the first 2 million doses given of anaphylaxis. Each of those responded well. No one died. This was about 10 times the incidence of anaphylaxis with a flu shot. So it's still rare, but those who have had anaphylaxis, we need to be a little more careful If you've had anaphylaxis to any vaccine, more careful even. If you've had anaphylaxis to any COVID vaccine or any of the ingredients in there, then you should not get the shot. Otherwise, there are no contraindications to the shot. And as we said, it seems to be safe in pregnancy and in lactation and for the immunocompromised as well. The only thing I'm watching, and there's in the fine print, some reports of acute MIs and strokes. And this rings a bell because those of clinicians who might be watching understand that the coronavirus, COVID-19, has effects on the heart and has been associated with clotting and strokes. And so people who get the virus are commonly anticoagulated to prevent these things. So will the vaccines also need to be used in caution with those who've got cardiovascular disease? That's one of the immediate causes I think we need to keep our eyes on as time goes on. Long-term late complications, you remember one of the flu shots had Guillain-Barré syndrome associated with it, which is an inflammatory progressive paralysis, which is usually reversible, but not always. We've not seen that yet that I know of. Transverse myelitis, which is an inflammation of the spinal cord, which could be at any level, and where it occurs can be like a complete transection of the cord. This tends not to be reversible, been associated with other vaccines. So far, we've not seen that, but it's still early and we don't know quite yet what the late-term complications are going to be. So side effects, expect pain at the site, fatigue, headache, myalgias. Those have been reported in up to half of myalgias or muscle aches, chills, particularly with the second one. But these all tend to go away within a day. So swollen lymph nodes is a kind of a unique thing that's been seen in some, and don't be alarmed if you see that. So we need to finish up, and I'll open it up to questions here in a minute. But what is the future like? Well, all these vaccines are coming out, and we can expect 2 more by the spring. Johnson & Johnson, which is a single dose, 1-dose vaccine, works by a different mechanism, is likely coming out with an EUA in February. The AstraZeneca Oxford one, which is currently being used in the UK, they're not even going to apply for that until later in the spring. But I suspect that it will be coming online in late in the spring. There's been some consternation about that one because some people inadvertently got a half a dose on their first dose of vaccine, and those people actually did better than the ones with the full dose. So that's having to be cleared up before they go before the FDA. What about children? So these vaccines are not for children. They're 18 and above. Moderna, the little engine that could, is starting to do research in children. That takes longer. So it will be a little bit before I think we'll be using these in children. The initial results, though, seem to indicate safety, at least in the 12 to 17 age group. Finally, our long nightmare is going to still be with us for the next 3 to 4 months. But it's, as has been said, it's always darkest before the dawn. But just like Easter, the dawn will come. So Until then, continue to be safe. Be careful. Keep doing everything that you're doing to be safe and to keep those around you safe. And when Dr. Fauci sings, when he sings, we can go fly. I'll stop there.
Thank you, Dr. Zorn. Thank you. Thank you. I'm going to field you these questions so you don't have to look at the chat. I'm just going to go straight down. There are a lot of questions. And if you have a question, let's kind of keep on putting it in the chat. And when we work through all those, maybe we can get conversation. But we got great questions. Thank you, Dr. Zorn. Thank you, everybody, for these good questions. I'm starting at the top with Father Dave. Dr. Zorn, are doses 1 and 2 of the vaccine identical?
Yes.
That's easy. Question number 2. Dr. Zorn, do you have any idea when the vaccines will be available to school personnel? Thank you, Laurel.
You know, I have a stake in this one. You know, our school teachers are frontline workers, and they are at exceedingly high risk. And they should be, like other frontline workers, should be near the top of the list. I don't have any idea when that's going to occur. The current guidelines are for nursing home greater than 65, those with underlying conditions, and medical workers. And as you know, there are huge lines among those populations to be vaccinated. So I don't know when we will go to the next round, but I'm hoping for school personnel, I'm hoping for soon.
Thank you. Another question from John. I'm a type 1 diabetic. Would it be safe for me to take the vaccine?
Absolutely. And the sooner the better.
From Dennis, what are the pros and cons of dispensing all available vaccine now versus holding back some for a second dose?
So that's a great question. There's a lot of, I won't say controversy, but difference of opinion about that. So what we know about one dose of vaccine is that it does provide some immunity. And the second dose brings that immunity, at least for these vaccines, greater than 90%. I think what the president-elect is wanting to do is get as much of the first dose of vaccine into as many arms as possible. And I can see that. And what he's banking on is that the enormous manufacturing capability of these companies and the availability of new vaccines coming will allow us to not delay the second dose of vaccine for too long for those who got that first dose and perhaps don't have an immediately available second dose. It's a great question, Dennis, and there's a lot of difference of opinion on that. But I can understand where the president-elect is coming from.
Following up, Laurel asked, do we have reason to believe that the second dose will automatically be available to those who get the first? What is the procedure for scheduling the second dose?
Yeah, and those of you who've been fortunate enough to have your first dose have been given a date to come back. And for Moderna, it's in 4 weeks, and for Pfizer in 3 weeks. So the president-elect is not going to be in office for another 10 days or so. So that's when so I think that the chances are that you might get your second, those who've been vaccinated already, you'll get your second dose. For those who have not been vaccinated, I think it potentially could affect you, and it might delay your second dose.
Question about from Leslie. How safe are you between the two vaccines?
You are not safe enough to do anything different. So that's a big thing to understand. The fact that you've had one dose of vaccine, you may be feeling good, but you're not immune. And you won't be immune until several weeks. I would say whatever the waiting period is between your shots, wait that same amount of time before you even breathe easy after your second dose. So no, I would feel good after your first, but not good enough to change any of your behavior.
Thank you. Mother Abby asked a question. When I have the vaccine, will I need to quarantine?
That was on behalf of someone who asked me directly versus to everyone.
No, the vaccine does not make you infectious in any way, won't make you test positive, will not give you the virus. If you were quarantining for some other reason, yes, quarantine, but not because of the vaccine.
From Dennis, excellent presentation. Thank you. Kathy Hall, can you take the vaccine if you've had Guillain-Barré? Did I say that right?
Guillain-Barré.
Thank you. There. Oh, wow, look, it's clear now.
That is a very good question, and I would defer that to someone smarter than me. I would probably, if you've had Guillain-Barré before, I would talk with your doctor, probably your neurologist, and see. Now we know that people who had Guillain-Barré with certain flu shots, the different flu shots, we've just not seen it with them. And I feel sure that some of them have had the flu shot and not gotten Guillain-Barré again. So some of them may not have ever taken the flu shot again too, but I would say it would be a point of caution, and I would not feel free to advise you the best thing myself. I think we would need a smarter doctor to say.
Thank you. Father Dave, I sense a new opera about Dr. Fauci. Okay, moving on here. Let's keep scrolling. Susan Ross, what do you think about, what do you think of the UK delaying the second vaccine?
I think we've talked about that some before. I'm not, I'm very ambivalent about that. And so I don't know, between now and when the president-elect takes office, things might change. I know he's getting advice from both sides on that. I will say that delaying the second dose does not make it any, eventually, once you get the second dose, it should still work very well. The time between does not necessarily matter in terms of where you end up, but it just may mean that you're not fully immune for that period of time until you get past your second dose.
Thank you. Lynn's got a question. Should the flu vaccine and the COVID vaccine be spaced apart?
No, you don't need to. In fact, that I wanted to emphasize this. You know, flu activity in Florida right now is minimal. We're bright green on the color chart, which is where you want to be. But we won't stay that way. And I want to emphasize to everybody to get the flu vaccine and to get it as soon as you can, if you haven't had it already. I've not seen anybody recommending delaying the flu vaccine or the COVID-19 vaccine because you need both of them at that particular time.
Question for Mary. Do you know if the VA is going to distribute the vaccine soon to veterans that are at high risk?
I don't know. It would seem to me the VA clinics would be a great place to get batches of vaccine. As you know, the vaccine batches were distributed to 300 and something odd hospitals and all the county health departments. And from there, they were distributed out further. And in Tallahassee, you can get them at the Bond Clinic, Neighborhood Health, Bethel AME, Bethel Baptist, TPCA, at FSU, at the 2 hospitals, if you happen to work there, the area nursing homes. So, but I haven't heard the VA in that discussion. The VA certainly has a population, I think, that needs to be served. And certainly their staff need to be served if they haven't already been vaccinated. So that's a very good question. I just have not heard the VA in the list of local options.
Thank you. Deborah's got a statement about trying to get the shot in Leon, the vaccine in Leon County wasn't successful. So she went over to Liberty County and she's left some information over there. You can cross the line and come to Georgia. We're not even wearing masks. So I'm sure we got plenty of vaccines up there. That's a bad shot at Georgia. I'm sorry.
Well, you know, unfortunately, I didn't know this till yesterday, but there are reports of people from out of state driving to Florida and just lining up and getting the vaccine, and they're not questioning where you're from. That I think needs to be some controls made on it, but more power to you if you can go to a neighboring county in Florida and get your dose.
Thank you. Mike is withdrawing his question because you've answered that. Dan's got a question. I think maybe you possibly answered this, but it's got is the Moderna vaccine as effective in 65-year-old plus population as the Pfizer vaccine? So he's kind of taking that
yes. Now that's a great question because there weren't as many over 65 enrolled. And another drawback to the Pfizer vaccine was only 9% of those in the study population were African American. As you know, the elderly and the African Americans have been, and the Hispanics have been bearing the greatest burden among serious disease, hospitalization, and death. So, I mean, that's a great question, but I would say the answer seems to be yes for safety in those greater than 65. I would take it. I took it. That's the one I took.
Thank you. Bud and Peggy have got a statement, but I think they continue the question down here. Should you take the shot if you've had a heart valve replacement?
Yes. Yes, I think the more you have medical conditions, the more you should take it. I just had that one tiny little concern about the immediate effects on the slight number who have had clotting, strokes, and heart attacks. That's going to need to be watched, but I want to say that's very rare among the population so far, and also among those who have gotten the vaccine so far. We are all part of a very large continuing study population that's going on, 5 million and counting. So we'll know more about a lot of these things as time goes on, but absolutely, if I had an artificial heart valve, I would be lining up to get the vaccine.
Thank you. Follow up one from Dan. I think you talked about second dose, but his what to do after the second dose. His question is, what safe activities may a senior undertake after receiving the second dose?
So the second dose is potentially can make you feel bad symptomatically for up to a day. And I don't think there are any specific limitations. I think how you feel may limit you. You may actually want to, the use of Tylenol and Advil in that setting has been pretty common. And you may want to use those and maybe go to bed for a while or lie down on the sofa for a while. That will limit you, but nothing, you won't be dangerous to do any activity that you feel like doing.
Got a question from David right here. David's mother's 99 years old. She's on the list, but he's 63 and her primary caregiver. Shouldn't it be a priority for him to get the vaccine, and how can he move? How can he get on that list?
You know, that's another great question. And in my heart, I say yes. I would just say that what you could do is appeal to the site of mother's immunization and give them your information, and they may give it to you. I have found that some of the places are allowing some leeway in that. And what allows this leeway? Well, you know, we've got this relative oversupply of vaccine, and we have just not been delivering it very fast. And I say, if you've got a primary caregiver right there begging for the shot, I mean, it behooves those people just to go ahead and give it and get it over with. That's what we need to be doing, is getting more people out there armed with the shots and more sites to give them. So
David has just put a follow-up question there. Where I guess where should he go for that? Should it be his mother's primary care physician or?
yes, I think so. I would inquire there first,
Okay.
and then your own physician if that happens to be different.
Leslie has a question about cancer patients. Whether they should get the shot.
Oh, I was waiting for Leslie to talk, but cancer patients, absolutely. There is no contraindication except for those who've had anaphylaxis with a vaccine, and specifically the COVID-19 vaccine. So if you're a cancer patient, you may be immunocompromised because of the therapy. That is not a contraindication. You should go ahead and get it. Now, it may mean that your immune response might not be as vigorous as measured by the antibodies. But what we can't measure is that cellular immunity, which is what gives me great hope about both the disease and the vaccines, is even though the antibody levels may drift down over time, the cellular immunity, those mean white blood cells, are going to hang around. They've got a long memory, years. And I think they're going to provide protection long term.
Dennis has a question about describe how the CDC uses an app to follow up with those of us who have received the vaccine.
I'm not familiar about that particular app, Dennis. So you can, if you've had an adverse effect, the CDC and your primary caregiver is encouraging you to interact with the CDC site so that you can give them what happened to you, describe that to them. So it's similar to the sites we've used for any vaccine, and keeping track of the side effects that have occurred. So when you get your vaccine, you should be getting an information sheet, which is about 4 pages long, and then a 5th sheet, which describes this CDC site you can go to and interact with and give your data about what has happened.
Question from Jerry. I'm a little confused about the difference between the Pfizer and Moderna vaccines for different populations. Was there a significant difference?
No, I don't think so. I think the Pfizer vaccine had a greater number of elderly um, enrolled. They were a larger study group, 44,000 as opposed to 30,000 for Moderna. I would think of these two vaccines as being extremely similar. They have the same mechanism, and they have had the same side effect profile. They've had the same effectiveness profile. I think they're going to end up having the same safety profile. So to me, there are two variations of the same thing.
A comment about there being no wait in Jefferson County. And Dan, kind of a follow-up from Dan saying his intent, the intent of his question was, may one resume public/pre-COVID activities after the second shot, or should there be some caution around that? And,
Well, I think everyone should be cautious still. So we're thinking about this too. Tasca and I, our daughter and her family are moving to Washington, D.C. We're trying to think about, well, after our second dose of vaccine, can we get on an airplane, which we've avoided to this point? I honestly don't think that we should relax what we're doing until we get closer to that herd immunity, which is 70 to 75% of us being immunized in the population. And that's going to take a long while. I do think a lot of us will be feeling better 3 to 4 weeks after our second dose, but I would still recommend that you that you wear your mask, that you socially distance, that you wash your hands. And I would not be having parties and that sort of thing. I think we should be very careful getting back to gathering until we get that herd immunity, which is going to take us a while. We need to be vaccinating about 1.8 million people a day. We're at about 500,000 a day now to get to herd immunity by late summer or fall. So I think we cannot and should not be in a hurry to get back to pre-COVID activities until we get to that point. That's my opinion. But again, I depend on people like Dr. Fauci, whose word has been gold, in my opinion, throughout this whole process.
okay, I have finished all the questions in the chat bar. Thank you for those. That's probably the best questions we've ever had on one of these. And thank you, Dr. Zorn. We probably have time for another question or two if somebody wants to jump in and say something before we got 5 minutes left.
I just want to say, Dr. Zorn, you handle those like a pro. You and, just like Dr. Fauci. There you go. Thank you. Thank you. Thank you for your wisdom. Thank you for your joy. There's you've seen the elf on the shelf. There's a Dr. Fauci on the couchy. If you haven't seen that, it was a wonderful alternative to the elf on the shelf. And thank you for being part of Coffee Talk and sharing your wisdom so graciously today. Thank you.
Dr. Zorn is also, I'm sure Mother Abby mentioned at the beginning, was ton of work on the COVID task force. So thank you for your insight and wisdom and grace and everything. Well, we are back here next week. We have many of you have gotten a letter about renewed themes going on here at St. John's, and Growing in Grace being one of those. In this coffee talk will start in January the 24th. But next week we're going to talk about a number of things, from Growing in Grace to renewal works, which I'll say a little more about. And Mother Abby will be on to talk about some renewal going on in pastoral care, and she'll say more about that. So next week is just learning about all these new things happening. So come back on the 17th for that discussion. Mother Abby and I will be kind of leading that. And Wednesday night continues. I will be in Essentialism. So
Hey, Father Wallace, I've
Yes,
taken
sir.
Growing in Grace before. Can I take it again?
you may always take Growing in Grace, Father Dave. Anybody who has been a part of Growing in Grace, yes, you need to take it. This is a wonderful opportunity for all of us to be on here. It'll be during coffee talk, so it's going to be a lot of fun. We've got some speakers lined up. We're not totally through with those yet, but we can say that Mother Julia Gata, Abby, got her wonderful
He'll
professor
be back.
to come
She'll be
back.
in April this year.
Our seminarian Chris has agreed to do one of the presentations, so I've been in conversation with him. So still, we've got some great speakers lined up for that. So it should be quite exciting. So if you've been in confirmation before, come back. It's time to do it again.
We want you to think of Growing in Grace like a booster shot.
There
Yes,
you go.
it's your second round of vaccine.
Second round. I will remind folks, we did record today, so it will be posted to the recording page. For those of you who might want to share that or refresh your memory from the presentation or the questions that were asked. We're so grateful again for all that was shared today.
Very good, very good. Well, thank you. Go in peace to love and serve the Lord.
Thanks be to God. Bye, y'all.